Well, I will bet a number of you watching us right now are struggling with back pain, and you are far from alone. Hundreds of millions of people suffer every year, making it the most common cause of disability in the U.S. But you don't have to live in pain. And in this sponsored segment, I'm happy to chat with Dr. Larry Todd, a spine surgeon with OrthoNeuro, about all of that. Good to see you, doctor.
Thank you for having me, Robyn.
I was just explaining to you, I said, you're probably popular at parties because people come up to you and say, I have back pain. I mean, this is such a common occurrence, is it not?
Second only to the common cold, taking patients to doctors. So it's something that we have a volume of patients who come in all the time, as well as at cocktail parties we hear about their back pain. So
hear about their back pain. And why is it such a common occurrence? Is it just that is such a part of our body we utilize so often, or?
Yeah, so anywhere from, patients will ask me, well, why do I have back pain? Why do I have a bulging disc? Or why do I have degenerative disc disease? And again, being second only to the common cold, there are three main reasons. Either where it's traumatic, you can get it from having a trauma on the job or work, and with the spine being in a highly mobile segment of the body, it renders a lot of stress to the spine. It could be pathologic, or it could be genetic. So sometimes we just are blessed from things that our parents get and we have no control over.
When you say thank you, Mom, actually don't want to thank you for that one. All right, so let's talk about the ways OrthoNeuro can help. And first of all, non-surgical, that's always going to be what people do first, right? And what people prefer, right?
Correct. So I am a spine surgeon. I've been in practice what feels like 100 years. But I tell my patients who come through the door that 80% of the patients who come through my door do not require surgery. And at OrthoNeuro, we have 8 spine surgeons, where we have the most fellowship trained spine surgeons in Central Ohio, and we all treat the majority of non-operative conditions. And I always tell patients, I'm the guy at the end of the line. And we talk about physical therapy, we talk about spinal injections, which we're also blessed to have great physicians at OrthoNeuro who specialize in injections, physical therapy. Our physical therapists have been voted best in Central Ohio several years running. So we have a whole host of things. And patients come in, you can see them nervous to hear meeting a surgeon, but I put them in, he's saying, listen, 8 out of 10 times, you're not going to need my services.
Exactly, and it is great. And two, you can even push it down the line a lot of times, right? Where people think they need surgery today, but you're able to help them so they don't need it for years to come.
You bet. And if anyone, viewers watching this, that have had back pain and or sciatica, terrible leg pain, it's a debilitating thing. I mean, patients get depressed. They're not getting rest. They don't feel like they're ready to tackle the day. But I tell them, listen, if you bulged a disc in your back, 8 out of 10 times, once again, 80% of discs resorb and heal on their own with time, and it's reassuring to a lot of patients, just saying, I love hearing that, doc, and just give them their card and say, you call me if you need me.
You mentioned that you have the most fellowship trained spine surgeons at OrthoNeuro. Why is that important? Why is that something that our viewers, that patients should look into?
Yeah, so I'm an orthopedic spine surgeon, and I was blessed to have great training at the Mayo Clinic. But during my training, half of my year was spent with orthopedic spine, the other half was spent with neurosurgeons. So people ask, is this an orthopedic or is this a neurosurgical issue? We say we have both. We have orthopedic and neurosurgeons. So specialty training, such as fellowship training, is just extra years of training that we go through to obviously learn the most advanced ways to treat our patients in the least minimally invasive manner. So it's nice to have that.
Yeah, and I know that things have come a long way too. You mentioned, right, you've been in this industry for what feels like forever. And it's not the way that people think, oh, I'm going to be, out of it for 6 months before my back heals. Like, how far have things come when it comes to doing a surgery, doing a procedure on the back?
You bet. So some of the minimally invasive discectomies we do, we tell patients they could be back on the job within 2 to 3 days. Now, we ask them to behave themselves, because sometimes patients go out and do too much, and we'll ask them about limiting their bending, lifting, twisting. But I mean, we get patients back very quickly if it comes to surgery.
And are there outpatient options these days as far as that too, depending on what they need done?
Absolutely. If anybody, again, speaking of OrthoNeuro, we have obviously a lot of total joint doctors at our practice that are doing outpatient total joints. And again, I'm old, I'm in that day, and I love seeing my new surgeons come out who look like they're 16-year-olds, and they're not, they're of age, but there are so many spine surgeries being done in an ambulatory surgery center. So, and some of my older patients will say, whoa, wait a second, this can't be done in an outpatient setting, but for the majority they can be, and they're such minimally invasive opportunities now these days.
And that's good to know. I think that is what you said, is reassuring for folks to know it's not what I thought it was a lot of times. So I want to let people know the team at OrthoNeuro, 5 convenient locations around Central Ohio. There is one within 15 miles of you, no matter where you live, okay? So go to the website, check it out, and you can reach out to the team today. Doctor, thank you so much.
Thank you, Robyn, for having me.